First, I want to thank each one of you, the soon-to-be graduates of our residency and fellowship programs, for the care you have provided and the support you have shown for your colleagues and all members of the healthcare team during this pandemic response. When I first stood in front of you during your orientation to graduate medical education at the Penn State Health, Milton S. Hershey Medical Center, and our family and community medicine programs in State College and St. Joe's in Reading, I don't believe any of us would have imagined how you would spend the last 4 months of your training experience. In fact, as one reflects on medical training during the last century, only a small fraction of physicians have practiced during a pandemic, much less finished their training in the midst of one. So, in many ways, this makes you unique. You also have been the unexpected pilot of virtual learning in GME. Although I am sure we all agree that for much of clinical training this is not optimal, for some didactic education it is. I know many of you were active in how these Zoom sessions were structured and initiated, so you can consider yourselves pioneers in this innovation for GME, which in some way, shape, or form is here to stay. Throughout your career, when you reunite with fellow graduates of your programs, I know COVID-19 will be in your conversations, but I hope it does not dominate your memories or define your experience here in Hershey. I would prefer you reminisce about your first patient, your first procedure, first successful resuscitation, first intubation, first suicide prevention, first diagnosis from a biopsy specimen or CT scan, your first publication, your first thank you from a medical student that you took the time to teach, or your first aha moment when instructing a junior resident or fellow. And I also hope you would recall your good times outside of the medical center with your colleagues, at your homes or apartments, at Trogs, Hershey Park, the new Chocolate Avenue hangouts, the surrounding trails and outside recreation areas, and on and on. My advice to you is simple. Your medical education does not stop here. Continue your professional development and your dedication to patient care. For my final recommendation, rather than provide a quote from one of the scholars in medicine, such as Osler, Rosalind Yalow, or Atul Gawande, I thought I would provide some words of wisdom from our own Pennsylvania Dutch community, which will be essential to you as your professional careers unfold. Meer muss und sich selber meer selbst. One has to take care of oneself. Your focus on your own well-being will not only be critical for you, but also in the subsequent care you provide to your patients. So, on behalf of our GME community, Milton S. Hershey Medical Center, Penn State College of Medicine, and Penn State Health, I thank you again for your service, your support, and your care throughout your training. We wish you the best, and nothing would please us more than to see many of you back in the Penn State Health system, providing the outstanding care, the education, the research, and the community outreach we have come to expect of our physicians and staff. If we can ever be of service to you as your career unfolds, please don't hesitate to reach out to us. Be safe, be well. Thank you.